All right, everyone. Thank you and good afternoon. We want to welcome you to the Statistical and Data Analysis webinar. We will be accepting more participants as we go along, but in the interest of time, we want to get started now. So thank you for joining us and for being so timely. This webinar today is sponsored by the Adirondack Rural Health Network and brought to you in partnership with Hudson Mohawk AHEC. And I am Katie Starr, Executive Director of Hudson Mohawk AHEC, and it is my pleasure to welcome you today. Today's webinar is the result of requests coming directly from your network, and we would like to thank Clinton County Health Department for their input on designing this webinar. In the next couple of hours, we will explore the basics of statistical and data analysis approaches to increase your ability to interpret existing data sets, use available health disparity data to inform program development, collect, analyze, and communicate primary data, and evaluate outcomes to demonstrate success. It is our goal that this webinar will be as helpful to you as possible. So in addition to a great level of content that we will be presenting, we will be taking breaks periodically throughout the presentation, and we will open the phone lines to allow for questions and discussion. And I will just make a mention that currently everyone is muted. When we open up the lines, we will unmute the lines on our end. However, if you've muted it on your end also, you'll have to unmute on your end too. You can also, if questions pop up throughout the presentation, feel free to enter them into the chat box, and we will address them during the break as well. So without further ado, today's webinar will be presented by Robert Martiniano, Dr. Robert Martiniano, excuse me, Senior Program Manager and at the Center for Health Workforce Studies at the School of Public Health in the University of Albany. He has an extensive background in health workforce research, survey and evaluation design, and project management, and is the lead staff on the development of federal shortage designations and state and federal service obligated programs. And today he will be presenting on data and statistical analysis for community assessment.
Okay. Thank you. Okay. So just to start with, despite what Katie said about me, I'm not a researcher. My background's history. So, but, you know, what I do is use data to help inform decisions and define policy. So this really isn't about research. What this is about is giving you some tools as policymakers and program managers to understand and use data to drive your program decisions. So again, think of it in that context. You're really trying to understand what you're looking at when you're looking at the data to help you do your community needs assessment, program development, and maybe evaluating your program. All right. We are not technically, okay, there we go. So as Katie said, I'm with the Center for Health Workforce Studies, and we do a variety of things. In the past, I've actually worked, not this cycle, but the previous 2 cycles with the Rural Health Network up here on their community needs assessment. Okay. So today's presentation, I really want to talk about, creating and telling the story, talk about data concepts and terms, go into some depth about secondary and primary data. Then we're going to have a question break. We're going to talk about survey design a little, identifying and using benchmarks, displaying your data, and program evaluation. And again, what we want to do is stop along the way to give you time for questions. And again, if you send something through the chat box while I'm talking, we can stop. We'll read the question, and then we will kind of answer it. Okay. So the first thing is really about creating and telling the story. And I think the first step is really identifying who your audience is and who your stakeholders are. Because it's important as you develop your story and collect your data to really understand who it's meant for. Because that's going to determine, one, how you present it, the data you use, and things like that. So again, define, as part of just telling the story and identifying your audience is then, what data are you going to need to tell the story? And the example that I've given to people that actually is a real life example from when I was working with you guys up here was one of the indicators that Department of Health told you to use was motor vehicle deaths. And I didn't feel that told the whole story. So I went back, found additional data on number of speeding tickets, pedestrian accidents, and tried to get a fuller story. So then as you look at it, does all of a sudden say, well, there's an issue with how people drive, or is there something broader that we need to address? So one piece of data may not tell the total story. How to contextualize the data will go into that, and what you want your end result to be. Okay. So let's start with what does the data tell me and what does the data not tell me? As you think about, again, your story, and you look at the data, what can you derive from it? What does it tell you? What doesn't it tell you? And how do you contextualize it? So another example I gave from up here was a couple of times ago when we were doing community needs assessment, we saw in Washington County a big increase in E. coli incidents. And we're going, okay, you know, that was weird. And what happened was, you know, and again, somebody contextualized the data and said it was because of the Washington Fair outbreak that happened at one point in time. So I think it's important to always understand who's in the room and how they can explain the data to you. Another example was what we saw was the increase in smoking rates in Franklin County. And I'm going, okay, how is it different than Essex County or Clinton County? And what people told me, again, contextualize the data, that with St. Regis up there, it was cheaper to get cigarettes. So again, it's not just about the data, but it's putting the data into a context that you can understand it. And again, as you're looking at the data, think about what's missing. So the data may take you so far, but you may need more data to understand the total picture, again, using the motor vehicle accidents as an example. And as you think about public health, you may have 2 or 3 indicators of asthma, but you may want to go more into it, or falls or something like that. And the other issue with telling the story is you're going to use multiple data sets. So it's not just about adult falls, but it may be about the increase in the elderly population. It may be other things that, again, you know, create a broader story. So again, think about the data you have, the data you don't have, and what's that telling you and not telling you. Okay. So let's talk a little about the questions of being asked. And I think that's somewhat the most important thing. What are you trying to get at? Are you using the data for community needs assessment? Are you using the data to develop or understand a program outcomes? And it's all important as you move forward. And then how the data is being presented. So we'll talk about all this in a couple of slides, but the level of geography, whether the data is being presented as a descriptive data or as inferential data. What terms are they using? What definitions are being used? Because a lot of times people will talk about data and it may not be the same way it's being presented. We'll talk about how that. And then where's the data coming from? Is it secondary data or primary data? And again, I'll go into the definition of these. Okay. So the first thing you do when you're thinking about whatever you're doing is what's the question you're asking? Are you clearly defining the question, what you need to answer, because that's going to drive the data you collect. You know, and also where you end up with your data. What result are you trying to get out of your data? Are you looking to create a community needs assessment? Are you looking to just develop a program or evaluate a program? You always want to know your end result, and that also includes who you're doing it for. So you may change your approach based on whether you're doing it for CEOs versus you're doing it for frontline managers. So always think about your end result and your audience. And then more importantly, if you're doing it for your organization, is it something that I can actually deal with? Because I could say, well, you know, we have a smoking issue, we have another, you know, a speeding issue, let's say. But if you're in the Department of Health, speeding may not be something you can actually address. So you got to think about it, whether it's in your realm to address. And even if it's in your realm, do you have resources to address it? Or are there other organizations and resources that are addressing it? So yes, it's a priority in your community, but I don't necessarily need to do it because other people are doing it. And a part of that is, can I answer it? Is it something that I actually have data for that I can say, all right, it's important I answer it and I have the ability to answer it. And then, especially for evaluation, is it measurable? Because somebody's going to ask you, I've just put county money or I put my organizational money into this program, how do I know it succeeded? And being able to measure it is very important to tell your boss or the community or your funder how you measured it and how you define success. All right. Okay, so let's start talking about geography. And most of the things that we do, at least that I've done with you up here, have been at the county level, but there are other levels of geography that you can look at. You can look at statewide, you can look at region. A lot of times, the data that you have will be presented in either the North Country or the Adirondacks, and sometimes that's good, sometimes that's bad. Is the level of geography based, does it tell you what you want to get at? So for example, if I'm looking at, again, smoking or asthma or diabetes, is it enough to do it at a countywide level, or is that masking some community-specific issues that I need to address? So you always want to think about not only the level of geography the data's coming in, but does that get to the program you're doing? And as I said, if you look at a larger area, are you masking problems in a smaller area? The example I give in Albany County, where we've got some rural areas and an urban area, if I look at the county as a whole, I may be masking problems in the more rural areas. So I got to think about who I'm delivering the program to and how that's going to play out. And finally, as I said, matter of convenience. A lot of times the data is reported statewide, countywide, because that's how they report it, but that's not necessarily how you need to use it. So you've got to kind of think about all the ways the data is reported and how that drives your ability to understand your problem or document your problem. Okay. So I wanted to talk, and again, the information I'm talking about is to get you to understand what you're looking at, not necessarily to create good researchers, because I think from your perspective as program managers and as directors of organizations, your job is to read something, understand that there's a problem, not necessarily to understand how they got to the statistics. So there are two types of statistics, descriptive statistics, and that's usually either in frequencies or crosstabs. And a crosstab is two variables, two or more variables, one by row, one by column or more, and that just describes your community. And frequency is just saying how, the number of people by age that smoke, the number of people in a community that have what level of education. Those are frequencies. That mine or yours? Oh, that's mine. Sorry. Inferential statistics is more trying to understand an association between variables. So is there an association, which we know, and how strong is that association between falls in the elderly, between smoking and where you live, between diabetes and your diet? Those are all associations that you use inferential statistics to describe. You're also describing, in some ways, in inferential statistics, a sample population. You're not talking about the entire population because you sampled them or you've collected data that doesn't represent everybody. So you're really describing that sample population and saying, one, does it represent the entire population? Two, is there an association between variables? And if you created a hypothesis, did your statistics and did your research either say, yes, my hypothesis is true or not true, false or not false? Okay. So I want to talk about a few terms just to kind of get you understanding of what you're looking at, what you're not looking at. So a lot of times in inferential statistics, you'll see what's called a p-value, and it's a number between 0 and 1. And the closer you get to 0, the more likely that it's not a random effect, that there is a true association. And again, it reports significance and findings of the research, and it indicates if there's a random or if there's a relationship, and again, it rejects or supports your research hypothesis. So it's really just a way to say, we did this research, we did a logistical regression, we did something else, and we felt that we could prove there was an association. And a lot of times that association is going to be depending on the number of people you survey, the questions you ask, like that. But at least understanding the p-value as you read a report or as you read research will help you say, does this make sense to me, and is it something I should consider? Okay. Mean, median, and mode. And the interesting thing about mean, median, and mode, there are reasons you use some and there are reasons you use others. So for example, all right, so let's start with mean. Mean is just an average. And usually you'll use it with continuous data. So, you know, you've asked the question, you know, what's your age? You've asked the question, what do you weigh? So because it's generally, you're not going to get many outliers, it may make sense to do that, to just find a mean on things. Median is when you're looking at the midpoint or the mid-value. And the thing about median is you may want to look at that when you have outliers. So for example, things like income, where it's not equally distributed because you don't have real low, you don't have, and sometimes you'll have real high depending on it, it may make more sense to do a median than a mean. So usually when I do income, or I use median income only because it makes more sense. Okay, and then mode is just what is the value that occurs the most. And if you had what's called a normal distribution, you may not use mode, but if you have something that's not normally distributed, that it's not that bell curve that you've kind of seen and heard about, then you may want to use mode because it's going to describe something. So I may find that in my workforce for nurses, I've got a lot of people. Not only do I have a mean age of in the 50s, low 50s, or a median age, but I may want to know that there are a lot of people between 55 and 60, a lot of nurses between 55 and 60, because that tells you something. And sometimes what you'll find is that all three are used in the, reporting the same data, so it just gives you a slightly different look as you try to understand your data. Okay. Ratio, percents, and rates. So ratios are a comparison of any two numbers, and percents are a type of ratio and rates are a type of ratio. So, and again, and we're going to go into some examples, different things get reported in different ways. So most of the times when you use percentages, you're just looking at a population and say, well, if I was to count 100 people, again, in this example, 87% of those 100 people would have a regular source of care. And then you just kind of say, all right, in my population of 30 or 40,000, it's 80% of that. A rate is an association or a numerical relationship between two related quantities in different units. So, in our normal lives, we're driving 57 miles per hour. We're looking at other things. But in healthcare, we really do talk about it in different ways. So the number of pediatric days per 10,000 people, population 0 to 17. The number of maternal deaths per 100 live births. So we're talking about two different issues, but in the same time, using the same kind of statistics to get you an understanding of how it gets put together. And I've got more examples. So, a lot of times we see, and in healthcare, and the thing about healthcare, we report things in so many different ways. And one of the things you need to think about as you're looking at your healthcare statistics is, one, how is it reported? And as you start comparing it to other things, can you make that comparison in general? So is it being reported per 1,000, whatever, per 10,000, or per 100,000? So as you see here, generally vital records are reported per 100,000. What are the number of deaths per 100,000 in my community? So I can look at Hamilton County with 4,000 people. I can look at the Bronx with 1.5 million people, and I'll know how many people died per 100,000, because if I just look at Hamilton County with its 4,000 people and Bronx with its 1.5 million, it wouldn't make sense to me. But by putting it in a per 100,000, then I can make a comparison. Now, whether or not that's a realistic comparison, we'll talk about. We also DOH also reports cancers rate per 100,000. So it gives you, you can compare Clinton County to Essex County. You can compare Warren to Washington County. So it starts having you understand where you are compared to other things. And you can also use it as benchmarks. So you can say, all right, I think a good benchmark for this is, 10 deaths per 100,000 for whatever the condition is. And then you can say, where's my county compared to that? Where are the other counties? Hospitalizations in New York are generally considered per 10,000. And the other thing is, you've got to understand your denominator also. And so if we're talking about general hospitalizations, it may be per 10,000 total population. When we're talking about pediatric hospitalizations, it still may be 10,000, but now you're talking children ages to 17. Births, when we generally talk about births, it's per 1,000 women ages 15 to 44. When we talk about infant mortality, you'll see, 5.7 or 6.1 or 4.3. It's per 1,000 live births. So again, it's telling you a couple of things. So infant mortality is based on the number of deaths over the number of live births. So think about not only the rate you're giving, but your denominator. Again, when you talk about fertility, we're talking about women ages 15 to 44. Even though we know that there are some births earlier and some births later, that's kind of a general statistic for understanding fertility rates. In terms of percentages, BRFIS, or the Behavioral Risk Factor Surveillance Survey, reports a lot in percentages. So what's the percentage of my population that smokes or has asthma or hypertension? So again, it tells you that in my county, given sampling size and all other things, I can reasonably say that 20% smoke or 30% smoke, things like that. And again, as you think about either comparing or putting counties together, you've got to kind of understand this so that you can reasonably come out with something that says, this is a reasonable statistic and this is a reasonable number. Okay. Oops. Oh, wait, hold on. Sorry, there we go. So are we stopping yet? Okay. So I want to talk a little about secondary and primary data collection to give you an idea of what data sets are out there and how you somewhat use them differently to inform your story. Because again, all this is about, as we described right at the beginning, is telling the story, creating the information you need to drive a program decision. Secondary data is that data that somebody else collected. Primary data is data that you collect through a number of means. And we'll talk about those means in a second. Okay. So again, secondary data is something that someone else collected. And we'll talk about the pluses and minuses of that in a second. But census data. So there's the American Community Survey that happens every year, that they will put out 5-year estimates. And I can actually look at the North Country, the Adirondacks, and use this to estimate your population, the age of your population, the diversity of your population. It even goes into things like who's working where. And I can say, well, it looks like 20% of the workforce works in hospitals, or 10% are in farming, things like that. I can tell, do I have an older population? Do I have a younger population? So it gives us some idea of what's going on in the population and the demographics. It even has a statistic around education. And so, again, thinking about the denominator, there's something called educational attainment, and what it looks at is everybody who's 25 years of age or older, what degree did you get? So again, as you think about these statistics, always think about where's it coming from, what's the question that's asked, what's my denominator. Another one is poverty. So they'll say my percent of poverty is X, but it's also a percent of the population that poverty could be determined. So what happens is there may be people they can't reach and they don't know the level. So you can't just take the 6%, you could. So you say it's of the population that you could determine, you're assuming that it probably covers the entire population, but there's that caveat as you use it. Labor statistics. So I use labor statistics a lot to understand employment, salaries, you know, who's employed and unemployed. You know, you'll see every month they'll say, well, the unemployment rate is. That comes from the current population survey. We're coming out with our annual report next month sometime, and we're actually going to report by region salaries by setting. So if I'm in a hospital versus ambulatory care versus home care, I think nursing homes, I think that may be, and home health. We're actually going to look at what the salaries are by those settings, so it can start giving you some more information about, you know, can I compete with it, salaries, or why is there a difference? There is a difference. Licensure data, we use licensure data a lot to try to understand who's licensed in what county. And then finally, the National Sample Survey of Registered Nurses. It's a national survey, but we can look at statewide level, what do New York State nurses look like? So again, we use a lot of these data sources. I know when I did community needs assessment, we actually used the census data and some labor statistics data, as well as education data from state education department to describe your population and start saying, all right, here's what the population looks like. Here's the poverty levels. Here's the percent of children in school who are on free or reduced lunch. And again, it starts telling that broader story of what I'm looking at. Okay. So as you look at survey data and secondary data, you have to think about a couple of things. Is it the entire population in the secondary data? Because there are some secondary data sorts like licensure data that's pretty much the entire population. So when I look at that, it's everybody who's licensed at a given point in time. Usually I use April 1st. But things like the American Community Survey, it's a sample. It's actually a 1 in 20 sample. So at the end of 5 years, which is one of their data sets, I have about 950,000 New Yorkers in the sample that can tell me something about the population. And you'll see, especially now with all the things around politics, they'll start taking surveys. How do you feel about this? How do you feel about that? And a lot of times they'll report it 2 different ways. Is it registered voters or likely voters? Because we know that registered voters are a lot bigger universe than those who actually vote. So as you hear about these surveys, you know, who are they asking? If it's registered voters, it actually may not reflect who's going to go to the polls. Likely voters, much more so. A lot of times when we talk about nurses and other health professions, we talk about those that are actively practicing in New York. So just as an example, New York has about 310,000 licensed RNs right now. And we estimate that only about 180,000 are actively practicing in nursing. So again, if I want to know my nursing population, it's more likely I'm going to want to know about the 180,000 population. With census data, as we were talking about, you can do total population in a county and civilian population. So civilian population excludes those living in prisons, in group homes, things like that, that you may not want to capture when you're thinking about your population needs. And finally, Labor Department data, they talk about jobs versus employed people. So much of what Labor Department reports are the number of jobs. So you don't know how many people are on those jobs. So one of the things we talk about is dental hygienists. And we know that many dental hygienists work multiple jobs. So while there may be 10,000, and I'm just throwing this number out, 10 or 15,000 dental hygienist jobs, we may find out there's only 12 or 8,000 people in those jobs because they're working multiple jobs. So again, as you think about your secondary data sets, what's it telling you? How's it being reported? What information is it telling you so you can make some judgments about it? Okay. So let's switch gears and talk about primary data. And right after primary data, we're going to take a break so we can ask questions. But, you know, one of the problems with secondary data, I'll go back to that first, is that it may not be asking the question that you need answered. It may somewhat get to it, but because you've asked in a very specific way, a secondary data source is not going to give you the exact answer you're looking for. So you may say, I really need to collect the data myself. And as you think about collecting your primary data, who are you collecting it from, and are they going to be receptive to your data collection methods? And so, for example, if I'm looking at people who are internet users, I may want to try to focus on a younger audience because, as we know in general, older Americans do not generally use the internet. So if my collection method is through the internet and I want to focus on falls in the elderly, that may not make sense. I may want to do another way, maybe go to senior centers, maybe go to the grocery store on a Saturday morning or Tuesday morning. So again, you want to think about how you're collecting data and from whom. And kind of along those lines is, are you getting the correct audience for your research question and for your survey? So again, if I want to look at the use of the internet by adults, I may say, I don't want to just go to high schools and survey teens because it's really not a valid approach. I'm not going to get an appropriate answer. And we're going to actually talk about some of the types of errors you can get when you're looking at those surveys. And so kind of all that leads to, creating your sampling frame. How am I going to get the people I want to survey? And we'll talk about this a little, but do I want to call them? Do I want to go to a store? Do I want to go to a senior center if I'm trying to understand senior issues? Am I going to do a random sample out of, this is kind of an old-fashioned thing, out of a phone book, or is there another way? And the last sampling I do is what's called snowball effect. So, for example, I want to understand nursing issues, so I know one nurse. So I call that nurse and say, what do you think about these nursing issues? And she or he explains it to me. He said, by the way, give me 5 of your nursing friends. And I call those 5, and they give me 5. And so I can actually do what's called a snowball sample by just using my contacts to expand on that. And sometimes when it's a very specific question, it's a great way to do it when it's a question that's so unique that only a portion of your population is going to give you information. A snowball effect may be a great way to do the sample. Okay, so just some ways to do primary data collection. There's both qualitative and quantitative data. So qualitative data is kind of I'm collecting words and impressions and what I observe. So focus groups and interviews, what do people feel about this? You go to, a lot of times you'll do a focus group around a program. So I've implemented a program, so how do people feel? Did that program make sense? Did it get to the people I want to do? And I may want to do a focus group because it's going to give me some very qualitative data about what people feel, what they thought. Interviews, kind of the same thing, it's more one-on-one. Observation, if I'm looking at how somebody treats a patient, how someone interacts with a client, I may want to do an observation. There is bias, and we'll talk about bias in that. So I really want to understand, I want to use what I see to kind of create my data. And then journals, I may want people to write down their impressions. I may say, all right, so I'm going to have you look at this TV show. It's on once a week. So for the next 2 months, I want you to write down your impressions of that show every week. And again, there is some inherent bias in that, and we'll talk about some of the way bias can get introduced into collecting data. Issues with collecting qualitative data. Just the data collection can be time-consuming and costly because I'm having to go to 3 or 4 focus groups and talk to them, and then spend time not only talking to them, but then coding the data and then drawing my conclusions from the data. So it can be a more costly method, definitely more costly than reviewing secondary data, but again, it may get to the question you need that secondary data is not. Okay. Qualitative data techniques, a big one that everybody uses is surveying, and surveying can be through a lot of things. through the phone, especially, you know, during when it's political, you'll get a ton of phone calls. How do you feel about this candidate or that candidate? With the advent of cell phones, it's become a little more difficult. So, for example, if a lot of times certain populations may or may not have access to cell phones. So you may introduce some survey bias into that by not getting everybody you'd want to get. You can do mail, you can do in person. I remember going to, in Crossgates, they used to do where you go Crossgates and somebody would pop out in Crossgates and Albany, and they would pop out and ask you some survey questions about movies you've seen or television shows you've seen or products you use. And then you can also do the computer or internet. And even with quantitative survey analysis, you can do observations in journals. So how many, you know, so you're looking at the number of people who went to this store, the number of people were seen by this clinician, or you can actually do what did you eat in a week. So every night you're supposed to write down, I ate, you know, for dinner I had, you know, meatloaf one day with mashed potatoes and corn. The next night I had a, you know, fish. So you can actually do, you know, again, both journals and observations. You can collect both quantitative and qualitative data depending on what you're trying to do and what you're trying to get at. Okay. So just some things to consider when you're doing primary data collection. So the first thing I wrote down is incentives versus coercion. A lot of times when you, collect data, you're giving an incentive. But that incentive, so if I'm sending, and we do this at the center, we'll send out a survey to physicians, but we'll include a $5 bill or a $2 bill. Now for a physician, that's not much. But if you're talking about a poorer population, that may become more of an issue. So I'm doing 25 bucks to get surveys of somebody who's in a lower socioeconomic status. That may be, it somewhat moves from an incentive to maybe coerciveness. So you got to think about that. You know, is my incentive enough to get people to think about it, but not so much I'm forcing people to respond. The amount of time, as I said, in secondary data, the data is already collected for you. You don't have to worry about it. But when you're doing primary data collection, there's going to be time and cost for that. If you're doing focus groups, you may have to train your staff to how do you interview, how do you run focus groups, because not everybody has that skill. When you're doing surveys and you're asking people questions, what's their literacy and their health literacy? You know, what I tell people is healthcare is a very specific language unto itself. And not everybody uses that language. So when we're writing surveys or when we're talking to people, it's very difficult. We have to watch the language we use. It was funny, I was in a meeting a couple of days ago, and this woman was talking to us and talking about all the different acronyms in healthcare. And sometimes as we're speaking, we go into that kind of the healthcare acronym language, but not everybody knows that. So you've got to be really careful how you write your questions and at what words do you use to ask the question so everybody can understand them. And that kind of goes to question validity as well as other things go into question validity, and we'll get into that in a second. Response rates. What response rates do you need to get an appropriate, to do the analysis in appropriate word? So if I'm doing 1 million people, I may have to survey 10,000 people to get what's called an appropriate response rate. What you notice, and if you go on to, you know, the different news show, they'll talk about a survey they've done, and they'll say, and I've got a, you know, plus or minus 0.3% error message. So I surveyed enough people, and it's 5%, and 5% are answering one way. It's really between 4.7 and 5.3% of the people answered this way. I'm not sure where it is, but it's close enough. The larger your error message is, the less confidence you have that's a good answer. And then as I said, the cost of doing primary data collection, you know, mailing, staffing, training, you know, and many times with especially mailed out surveys. You're doing multiple mailings, and there's a cost for that. Okay. So I wanted to talk a little about survey bias. So partly as you think about if working with somebody to develop a survey, also as you see surveys on the television, or somebody's asking you survey questions, you can think about that. And there are a number of biases. Interviewer bias. So if I'm doing an interview with somebody, how's my body language? How am I coming across? How am I interpreting? Because so if I ask a question and then I give a frown, are they going to answer one way or another? How's my body language? Do I seem open to their answers? Because that is all going to influence how somebody responds to a question. So, especially if you're doing an in-person interview or in-person data collection, think about who's asking the question, what their body language is, how they're asking it, and also how they're interpreting results. Recall bias. So I gave an example of doing a journal to understand what you eat. So what they should be doing is every night answering the question, what I ate. But what about if they only do it once a week? Now, I can barely remember what I ate last night, so it's going to be, so if somebody asks me, Katie's laughing. So, one of the things going to happen, so if I only answer once a week, I may really screw up my journal because I won't remember what I ate. Even some other questions like, how many miles did you drive last week? So as you think about the questions you ask, is recall bias going to be an issue? Okay, other biases. There's what's called response bias. So, so somebody will call you on your phone. How do you feel about this politician? You may say, yeah, I'm indifferent. I'm not going to answer. But somebody who's really either ticked off or really supportive may answer. So you're going to get a little self-selection in some of your survey questions. So if you're calling about your organization, if they've really had a negative interaction with them, they may be much more likely to answer, and you may have a much more negative response in general because they've selected themselves. And I put caller ID down here. I know in my house, when people call, we'll screen with the caller ID. So if we don't know it, we may not answer the phone call. So again, there are a lot of ways people self-select into surveys. Also, how we respond to questions. It also goes back to some culture as well as health literacy and our knowledge. So do we always answer yes to things? Do we always kind of, regardless of how we feel, we're not going to give a negative response? Do we have knowledge about what's being asked about? Because that's a huge issue. If I start talking to adults in their 50s or 60s about some of these games that kids play now, they may not have knowledge, and it may kind of skew your results. And again, the language we use in the questions. Are we asking in a way that they'll understand what we're asking, and so they can respond appropriately? Finally, social desirability. So especially in a face-to-face interview, people may respond how they think you want them to respond. So do you smoke? Oh, no, I don't smoke. And then you walk out the door and light up. And in a lot of ways, and there's something called a youth behavioral risk behavioral factor survey or something like that, the youth survey. And what happens is they'll ask about drug use. And some kids, I want to be cool, so I'm going to just, write down every drug I use. Or just click on every drug, yeah, I'm using it. So sometimes the social desirability is negative or positive depending on how the person responds. So you got to think about that. Are they responding because they think that's how you want them to respond rather than that's really how you need to respond, how they feel about responding? Okay. All right, I want to stop here for a second. We're going to unmute people, unmute everybody. And again, if you have a question, you can just yell it out. We're getting a little feedback there, but that's... I think we just...
Yeah, I think we have some technical difficulties. I'm not really sure what to do about whether it's feedback from someone else or because of our setup here. So I think at this point, what I prefer, just to save us all from that shrieking noise, if you all heard it as well, is if you have any questions, to go ahead and tap them into the chat box, and we'll just give a minute or two. We'll let Robert take a deep breath, and any questions that come through the chat box we will address in just a moment here. All right, we did not see any questions come through, so I'm going to turn it back over to Robert, and we're going to let him continue.
So the next thing I want to talk about is survey design. Again, I don't expect you guys to write surveys. What I expect you to know is as you're using surveys for your program, to understand what's a good question, what's a bad question. Again, as someone may ask you a question, as you're being surveyed, you can say to yourself, is this a good question or bad question? I remember answering a survey, a political survey, and after the second question, I knew which party it came from. So again, survey design is very particular. You're going to want to, engage a researcher who can help you write good questions if you want to, kind of design a survey and try to understand what's going on in your program. Okay. So again, I don't want to go into the nitty-gritty of this. I think it's, even for me, it can be boring, and I have staff that do this. So what sample size do you have? What sample size do you need to get to the questions you want to get to? So if I'm surveying all of Clinton County or Essex County, how many people do I need to get a reasonable size? And for you, those of you who have either used or heard about BRFIS, they get a minimum sample size of about 600 from each county because they believe that gives them an appropriate response rate. So when they report their information by county, they believe that it represents the counties. Sampling cells, like sometimes you're going to say, well, I'm going to sample everybody. I don't care their age, their education, whatever your question is. But sometimes you may want to create a sampling frame or sampling cells to break it out by geography, by education, by age, and there are others, because you may want a more nuanced response, and you may want to weight back to WEIGHT, weight back to the responses at the end. But just be aware that if you're doing sampling frames and sampling cells, you're going to need, within each cell, you have to have an appropriate sample size, which means your overall sample is going to be bigger. Do you want to oversample for small n's? So we're in the North Country, and we have a smaller percentage of our population are racial and ethnic minorities. So if you really want to get, if you were to do kind of a general population sample, they're going to represent a small response in your sample. But you may want to, whatever the question is, you may want a higher response rate, so you may want to oversample that to make sure that you have an adequate response rate. I know that we've done this in the past when we've done nurse practitioners. We've looked at some of the smaller nurse practitioner certifications only had 500, 600, so we would oversample them versus family nurse practitioners that are in the thousands. And then the other thing is for sampling, replacing bad addresses. So as you start sampling, you're going to get returns on the addresses. So did you build that in, that's a non-response, or do you want to send out it to either the better address or another person to get an appropriate response rate? Now, we've done it in a couple ways where one thing we actually randomly assigned who was going to be in response rate. In an Excel file, we just did random numbering, and the first 100 or 200 people were sampled. And then if we got one back that was a bad address, we went to 201 or 202 or 202 or 203. So there are a number of ways to do that to get your response rate where you need it. Okay. So we've talked about response rate, but what to consider during survey implementation. Writing the questions. We're going to go into what's a good question, what's a bad question. Response rate, we've talked about implementation costs. So there's cost to developing the survey, marketing the survey, getting the survey back. If you do it by mail, there's printing. If you're doing electronically, you usually get a cost per response. And then, what's not down here is data analysis. You're having to then format the data, clean it up possibly, and start analyzing it. As you think about your survey, length is important. What we say at the center, the longer the survey, the less likely you're going to get a response. So there's a balance of how many questions do I need and what's my response? Because if I'm going to start adding too many questions, I know it's going to hamper my response. What's the order of the questions? And there's no good or bad answer to this. That some people say put the easy questions at the beginning, so then they're invested in the survey and they'll do it. Some people say put it at the end, so they'll get to them and they'll whip through. There's no good answer for that. Just you do it by feel. What's your instructions? Where do you put instructions? So a lot of times when I write surveys, I put instructions at the beginning, as well as for some specific questions, I'll put instructions. And jumps. Jumps are skip logic. So if I'm in a survey and I may say, all right, I want, I'll give RNs for example, since that's what I do. So the RNs are responding, and at one point I may say, if you're working in a hospital, I want you to ask these additional questions. So I may jump questions. If you say no, I'm going to have you skip over some questions to kind of give you a screening question. So use jumps and skip logic to really focus your questions to certain people. Okay. And again, I'm not telling you this, so I expect you all to go out and write a survey, but I think it helps you understand what's going on when someone else works with you to develop a survey. And I'll skip this because, or I'll go over this really quickly. Getting to an answer. I always put no before yes. As I said, a lot of times people will just check the first answer. So I want to make sure they're reading it by putting no, so I don't just get those people that say yes to everything. When I ask race, ethnicity, I'll usually ask it over 2 questions. What is your race? Because there's really 2 answers. So it's, what's your race? And then are you Hispanic? Yes, no. Do you want to put unsure or don't know in your answers? Because if you get too many, it's not going to help. But there may be cases where unsure or don't know is a reasonable response. You want to think about that. Do I want to make my questions mandatory or voluntary? So they may get into the survey and say, I don't really want to answer this question, and can they skip it and just go to the next question? Depends on what you're trying to do. Finally, are you using one question to get multiple answers? Those survey questions that say, check all that apply. In New York, as an NP, you're a registered, licensed as an RN, and you're certified in one or more of 16 NP occupations. So when we ask about what's your NP certification, you can answer up to 16. So that's an all that apply. Sometimes you may be asked, why did you buy a product? And it may, well, it was a good sale. I know, there's a sale on it. I know the product. I think it's good quality. So you may answer 3 or 4 things. Okay. Just type of questions, yes, no, true, false. Again, single answer, you can do it. I'll go to open-ended first. So you may ask for what's your year of birth, which would be an open-ended question. Or you may say, what year were you born, and give a, 1950 to 54, 55 to 59. Or you may say, what's your age, 45 to 49, 50 to 54, things like that. Depends on what you do with the data. I like to ask for year of birth so that if I'm using it in 2 years, I'm still saying, all right, these people are 60. And maybe when I asked the question, they were 57, but I'm saying the 60-year-olds responded in this way, even though I know the survey was a couple years old. Single answer, again, yes, single answer, you know, how did you get to work today? I took a taxi, I took a bus, I took a, you know, whatever, or I drove or walked. Multiple answers. Again, things around, you know, how do you feel about this? What was your reaction to this? And then ranking. A lot of times you may say, all right, I want your impression on this, you know, how do you feel about this TV show? So rank it, you know, 1 to 10. Or you may use language, how do you know, in a Likert scale or another way. Or, and I've even seen it where a thermometer, how hot is that? How cold do you feel about this or that? So there are multiple ways to ask questions, and you want to think about those ways. And sometimes it's what's the easiest way to ask the respondent to respond, because it may be the simplest way and may allow them to get through the survey the quickest. And the other thing with open-ended questions, especially if it's narrative, you're going to have to text and code those questions. And even, it's funny, even with year of birth, sometimes I've got it where their birth will be 64, and rather than writing 1964, they have 64 in the 2 digits, or, you know, maybe 62 in the 2nd and 3rd digit, and skipped the 19, or just wrote 19 and forgot to do the rest of it. So again, so when you're doing open-ended questions, you're also adding in some problems with the data and the need to clean that data. And the last question type I want to talk about is a Likert scale, where they're going to say, you know, how did you feel about, you know, the Jets playing last week? And it may say, you know, how did you feel about the Jets offense last week? I thought, you know, I really liked it. I somewhat liked it, whatever. You can do that with questions. You can try to get, you can quantify a person's feelings about a subject rather than ask them that and getting a, doing qualitative analysis and getting a narrative. You can quantify it by giving them the Likert scale and say, on a scale of 1 to 5 or 1 to 7, you know, how did you feel about this? Whether it's food you ate or sports you watched or, you know, the care that was delivered to you, you can get it in a Likert scale. Okay. So I want to go a little into the type of questions you can ask and how you can ask them. When you ask things, and I'll go to the mid one, you know, how exhaustive is your list? You know, work shifts and hours. So when you start asking about nursing work shifts, it's not just 9 to 5. Some work 7 to 3, some work 6 to 2. On weekends, they may work 12-hour shifts. So you got to think about all these ways that somebody could answer. Race, ethnicity, did I give all the probabilities? Again, NP certifications, there's up to 16, so did I list them all? If I'm going to do categories for age, incomes, language spoken, do I want, how broad or narrow? So language spoken, do I want to say African or European, or do I want to go, if I'm using European, do I want to say French, Italian, Spanish, English? If I'm doing age, do I want to do 10-year increments, 5-year increments? You know, again, it's going to tell you, and what are your cutoffs? It's going to tell you, it's going to limit what you can do with the data when you do that. So do you want, if you're going to ask categorical, you got to understand that. Income, do I want to make it an open text question where they put in the number? Do I want to give them a range? Because sometimes people say, I'm not going to write down a number, but they're more willing to say, I'll respond, you know, if it's 100 to 124,999, more willing to respond like that. And that's the other thing. Sometimes some of these questions may be a little sensitive, and giving them categories may allow them a little more flexibility in answering and not feel like they don't need to answer. Okay. Okay, so question design. Is the question too vague? So within the last year, how did you feel about politicians? What do they mean by last year? So we're in November now. Did they mean 1990, right? 2019, did they mean the last 12 months? So it's not specific, I don't know. And if we're talking September, August, July, whatever, it really becomes more problematic. Same thing, how is crime in your area that you live in? Define area, do you mean the block I live on, the city, the county? Again, if they have to start thinking about what you mean by the question, you may have lost them. So, you know, so if you're going to do that, you know, within the last 12 months, in 2019 in your city, in your, even in your neighborhoods, it's a little more specific than your area, in the block you live on, things like that are going to get a little more to the issue and tells them to say, all right, what's going on? Is the question loaded? So, so did you ask some emotion to the question that's going to maybe elicit a response by virtue of how you asked it? So do you believe we should redistribute wealth by allowing tax breaks? And actually that's two questions. We'll go into that in a second too. But so we're talking about, it's really asked a question that there's some emotional value to. Should we avoid buying imported cars to save American jobs? Again, there's value judgments there that may not make sense and may elicit a response you don't necessarily want. So you got to think about how you ask questions and if they're loaded in terms of emotional response and how they're written. Kind of similarly, is the question you're asking assuming something that's not established in fact or is a leading question? So, again, you're not going to, if it was an in-person survey, at what point did you stop speeding before you came upon the accident? We never established that you were speeding, but you've asked that question. The next one down, we've created our nursing program to graduate first-rate doctoral nurses. What are your thoughts about this change? You never said it was a first-rate doctoral program. You never said you thought it was a good program, but we've already put that in. It's kind of a leading question. I've seen somebody that said, how did you, somebody wrote a question for nursing, what's your dissatisfaction with nursing? They didn't ask the nurse if he or she were dissatisfied, they put the question in. So again, you got to try to, if you want to ask something about satisfaction, dissatisfaction, determine first if they are satisfied or dissatisfied. If they're not, then do a jump or skip logic. If they are, then you can only go in the second question. So some of these questions really need to be two questions or written in a way that you're going to get the first amount of information. Compound questions. And again, that is asking two questions at once, and you really can't answer one. And sometimes it's a yes and a no question. And I know lawyers are sometimes notorious for this. On the stand, they'll ask you a compound question. If you answer it one way, you've implicated yourself, even though half the question you meant one way and half the question meant the other. But is your city a good place to raise children and experience culture? The answer may be, yeah, it's a great place to raise children, but culture is so-so. But you've, but it's one question, how satisfied with your current nursing position, your salary? You may say, yeah, my nursing position is not bad, but my salary could be better. Again, you've asked a compound question. And the last one gets to kind of emotional as well as compound, but should the government spend more taxes on military programs and less on social services? You may say it's actually two different questions. It's yes, no on military, yes, no on social services. So you really want to be careful about how questions are asked and what they're getting at, because, as a, kind of garbage in, garbage out when you ask the survey question. If you ask the question poorly, you're going to get poor results that you're not going to be able to use. Okay. And all these, how to develop a survey and how to write good questions and how to create the survey and the research and the sampling frame get to these three things. Can the findings from the general study be extended to the general population? So if I'm surveying elderly adults on internet use, even though I wanted the general population, I'm not going to really be able to say that it applies to the general population because I just didn't measure it appropriately. And that also goes to validity. Are you measuring what you're supposed to be measuring? If you're measuring internet use on the general population, you're going to want to distribute the questions along an age group, because if you focus too much on one age group or another, you're going to get invalid results. And then feasibility is the evaluation of the research tool realistic and economic to perform. Were you able to do it in a costly manner,
Cost-effective?
Thank you, cost-effective manner that makes sense, that gets to your findings you want. Okay. All right, so we're going to take a break for questions now.
And again, I think it might be best if we don't unmute the line. So if you want to just take a moment and try to enter any questions you have into the chat box, we'll just leave that open for a minute or so. All right, well, it looks like we have no questions, so certainly, you know, feel free if anything pops up, jot that down in the chat box. We will have one more chance for questions before we close out today, but without further ado, we'll turn it back over to Robert.
And the other thing is I did put my contact information on the first slide, and I've created, and we will be sharing the slides. I created a PDF of the slides that Katie will send around or put someplace.
It'll be in an email.
Okay, it'll be in an email. So that way, again, you can re-look at the slides and you can say, all right, you know what, this is a question I have that I can send to Robert or Katie. Okay, so one of the things as you assess your program is, how do I know if I'm doing good or bad? How do I know if it's a program or it's an issue I need to address? And the best way to do that is to compare it to something. And comparing it to what is really the question of the day. So how do you establish benchmarks? And this is really kind of unfortunate, just kind of a two-thing slide, or a one-slide issue. But so how do you, what are your benchmarks? So one, historically. So if I look at smoking rates, is it going up and down, up or down? Is it staying the same? Diabetes, asthma. You know, so if I see a drastic increase in those, maybe I need to deal with it. But if I don't see an increase or I see a decrease, even if it's a level that may be higher than my neighbor, I may say it's not worth doing. And compared to other same-size geographic levels. So I may compare Warren to Washington County. I may compare Essex to Clinton County. I know those are populations may not be exactly the same, but something like that. I mean, the example, would I compare Hamilton County to Kings County or Brooklyn in New York City? Probably not, for a number of reasons. One, the populations are very different, but the size is very different. You know, 4,000 versus 2 million plus. So I'm going to want to look at a way to compare it that makes sense, that I can say, all right, so here's a good benchmark and here's what I'm comparing against. Maybe I want to compare it to the regional. So in the past, when I've worked with your counties on doing community needs assessment, I gave a regional benchmark. So here's your county, but here's what it looks like in the region. So am I better than the Adirondacks or North Country, whatever I did? Am I worse? You know, where am I along the line? Upstate, downstate. A lot of times, especially in upstate New York, I do not want to look at the whole state, because New York City is going to skew the results, especially depending on what the indicator is. So in New York City, asthma rates are much higher than upstate. And if I look at the state as a whole, it's going to be skewed because of downstate results. So I may want to say, I'm going to exclude New York City, but look at every other county. I may exclude, depending on the variable, New York City, Long Island, and look just at, you know, everything Westchester up or above Westchester and Rockland. So again, you want to think about what makes sense for your benchmark. And you can also look at statewide again, and it may depend on your variable. Statewide may make sense. Also, both the state and the federal government may give you a benchmark. I know the state created the prevention agenda, and they say, here's your benchmark. So you can compare it against that. But again, if New York City's in there, especially for the Adirondacks in upstate New York, it may not make sense. While you need to use it to kind of understand where you're going, you may also want to use it look at upstate or look at your region to see how you compare. And then national benchmarks, Healthy People 2020. And there are many other benchmarks. I was in a meeting a couple of days ago and with another state, and they say, look, I just looked at the national average, or I think it was the statewide average for the number of physicians per 100,000 or per 10,000, whatever it was. And then I looked at each county against that average to really understand where I was. So again, it's just giving you, some benchmarks are just going to kind of put you where you are relative to other people. Other may be a goal like, Healthy People 2020 or the prevention. So I wanted to talk a little about displaying your data, because I think it's important not only to understand how you can put your data out there for your constituents, because you're all working for somebody, or as you see reports that I've either done or AHI have done or somebody else has done, to understand what the table or the figure means. So there's really two ways to present data. One is in tables, and one's in charts or figures. So tables are generally represented in rows and columns. It's very precise. So you're going to see the percentage, you're going to see the number. Sometimes you're going to see both. And generally in tables and charts versus figures, you can do summary information. So if I'm doing the 10 counties or so in the rural, the region up here, I may want to do a regional total that says, all right, I'm looking at smoking rates by county, I may want to do 20, 15, 18, whatever, and then I'm also going to show what the region is. The caveat is with tables, you're going to have to limit the number of rows, because as you get too big, you're going to lose your perspective. It's going to be hard for people to follow and to read, which is where charts come in, because then it's pictorial representation of data. You can put more on, and you can also, it's easier to see trends and findings, but it's not going to be specific. I'm not going to see that necessarily see that 20% of my population does something. What I'm going to see is a line that's around, as my line goes up, I'm going to see where it crosses 20% or 25% or 30%, and I'll have some idea. I did want to talk a little about, about the type of charts you can use and when you use them. So a pie chart is when you're doing part of a whole. So if I'm looking at my population, I want to see how many people have an associate's degree versus a bachelor's degree versus master's or more versus a high school or less. I may have a pie chart that shows my entire population, but in percentages or parts of the percentage. So 25%, whatever. So it gives me a picture of a whole. Now, actually, with bar charts, you can kind of do that, but also shows frequency. So I can do frequencies of different groups. If I do a stacked bar, I can also do part of a whole. It's a little harder if I'm comparing groups and showing the different groups. Now comparing among groups, but within my bar, I'm going to show the kind of the percentage up to 100. So you can do both, but it gets a little busy. A line chart, you can do a comparison over time. And again, you can see, is it above or below where it crosses the number? And then finally, an area chart, compare part to a whole over time. Now, the first three I didn't do examples of because most of you have seen those. I didn't want to bore you. But I did do an area chart, actually one from a study that I've done recently. And it's an area chart of nursing graduations, bachelor degree nursing graduations in New York. And the bottom number is what are called BSN completers, the number who went from associate degree to a bachelor's degree. And then the orange part is the number of bachelor that went on for 4-year bachelor programs. And as you can see, two things by this chart. You can see that in general, the number of bachelor degree graduations have gone up. And in both cases, BSN completers and 4-year BSN graduates, they've gone up. So it gives you a couple of different things. So it showed you a trend over line, but it also showed you the proportion of BSN completers to either total graduations or to four-year graduations. Again, as you think about how you use chart, you know, what chart am I using? What am I trying to show? And does it make sense? And how easy it is for people to read. So I want to finally stop with program evaluation. Just because I think, again, I don't expect you to create your program evaluations, but as you think about implementing your program, you should think about how you're going to evaluate the outcomes. So program evaluations help to define priorities, help to understand whether your program fits into, the program you're implementing fits into your organization's mission, vision, and values. And actually, we had a meeting earlier, with the AHEC had a meeting, and we were talking about just that. You know, if you're going to do a program, how's it fit into what my organization says it's supposed to do? What kind of resources am I using for this program? Does it make sense? And what are my outcomes? Because ultimately, your evaluation may help you decide to redesign the program, to stop certain parts of it, or maybe to implement it wider because it's doing so well. You know, as you're doing your evaluation, you know, more specifically, are you performing the activities you said you were going to perform in your work plan? Are you doing what you're supposed to do, which is a process evaluating? Outcome evaluations, did you spend money in an appropriate manner? Did you meet or exceed your goals or objectives? And then finally, did you do things efficiently? Did you do it correctly? Or did you do things effectively? Did you reach the population you were going to reach? Did you do the things you wanted to do to get your desired outcomes? So as you think about your evaluation, you need to kind of think about what I'm doing, how I'm doing it. The other thing with evaluation I need to stress is, and it's happened to me where after a program's been implemented for 6 or 8 months, they come to us and say, we really need to understand how this program is functioning. You want to get your evaluation started at the beginning. You want to say before program implementation, what am I trying to do with evaluation? So if you have to collect specific information, you're collecting it, you're knowing what you're doing at the start rather than halfway through. And we've talked a lot about this. You know, if you're going to do your evaluation, how are you collecting analysis? Quantitative data or qualitative data, or is it a mixture of both? And again, we've talked a lot about this. But just designing your evaluation, again, design it before initial program implementation. Create your research question. We've talked about that a little. You know, what are you trying to find out? Are you trying to understand whether you did what you said you were going to do, a process evaluation, or you met your outcomes? You know, did I treat the number of patients I was going to treat? Did I, you know, reduce asthma or diabetes, like I said I was going to do? And then how you collect your data, how you interpret your findings, drawing your conclusions, and then probably most importantly, making recommendations. You know, because you're going to be, the evaluator is going to tell you as a program manager how you succeeded. You know, did you do the things you're going to say to you're going to do in a program evaluation? Did you, and again, you can do both a process evaluation, you can do both the outcome and a process evaluation at the same time. Did you do the things you said you're going to do, and did you meet the goals you said you wanted to meet? Okay. So I've been talking a long time. So I just wanted to kind of give everybody a break again. And we're about 9 minutes from an hour and a half. And I applaud you guys for listening to me droning on for that long about this. But does anybody have any questions?
And we will give another shot at unmute all and see what happens. Okay, that is more favorable. So does anyone have any questions or comments for Robert while we still have him with us?
Anybody?
You put them all to sleep.
Yeah. I had to wake up Katie a number of times too. But again, as you think about these and as you review the slides once Katie sends them out, You can send questions to me. Again, my contact information is on the first slide. You can call me or email me, and I'm more than happy to help you. And again, my role here today wasn't to teach you to be sound researchers, because again, I'm not a sound researcher. I have people on my staff that does this, but really to help you understand data as you look at data for program implementation, or how, or as someone presents you with an evaluation or findings from something they did, that you can look at and say, okay, I understand what you're trying to say to me. Now, how does that allow me to implement my program or do something I need to do to address an issue I have in my organization or county?
Wonderful. Well, I want to take a moment to thank Robert for his very informative presentation. And on behalf of Adirondack Rural Health Network and Hudson Mohawk AHEC, I want to thank everyone who participated today. We do hope you found a few helpful takeaways from today's presentation to inform your future data collection, program development, reporting, evaluation, and more. And as Robert said, we will be sending an email shortly that will include the slides from today's presentation, so you'll have them available to you for your reference, as well as to gain access to Robert's contact information. And the email will also include an evaluation link. And I want to ask and implore everyone to please take the few moments, it's probably going to take 5 minutes or less, to give us a little bit of feedback about the training today. We want to know what you thought of today and the information that was presented, but we also want to know, I'm sorry, I'm just getting the lines again. We also want to know what you would like to hear from for future trainings. This training came out of feedback we got from your peers. So if you have a need for training, we want to hear about it. We want to bring it to you. And I speak on behalf of AHEC and Rural Health Network in saying that. So today's webinar has also been recorded and will be available on AHI's website through HealthStream in just a few days. And once again, thank you so much for joining us, and we hope you have a great evening and a happy Thanksgiving.